Hello and welcome back. In today's video, we will take a close look at cholera, a potentially life threatening but preventable disease. Though it's often associated with history books, cholera is still a very real threat in many parts of the world. We will explore what causes it, how it spreads, the symptoms, treatment options, prevention, and its global impact. Cholera is a severe diarrheal illness caused by the bacterium Vibrio cholera. The hallmark of cholera is sudden and profuse watery diarrhea that can lead to dehydration within hours. If left untreated, cholera can cause death. However, with prompt treatment, most people recover fully. Cholera has been responsible for several pandemics since the 19th century. The first known pandemic began in South Asia in the early 1800s. Since then, the disease has swept across continents in waves. According to the World Health Organization or WHO, cholera still affects up to 4 million people and causes over 100,000 deaths each year. Cholera remains a public health emergency in areas lacking clean water and sanitation. The disease is caused by a gram-negative bacterium called Vibrio cholera. There are several strains, but only two serogroups, O1 and O139, are known to cause large outbreaks. These bacteria produce a potent toxin called cholera toxin, which disrupts the normal balance of salt and water in the intestine. Cholera is primarily spread through the fecal oral route. That means it is transmitted by the ingesting food or water contaminated with feces from an infected person. It thrives in areas with inadequate sanitation, unsafe drinking water, and overcrowding. During the natural disasters or conflict, cholera can spread rapidly through refuge camps and communities. Symptoms can begin within a few hours to 5 days. The average incubation period is about 2 days. This short window makes outbreaks challenging to contain, especially in vulnerable communities. The most classic sign of cholera is profuse watery diarrhea, often described as rice water stools. Patient may also experience vomiting, leg cramps, and rapid heart rate. The dehydration can become severe quickly, leading to sunken eyes, dry skin, low blood pressure, and extreme thirst. Without immediate treatment, it can lead to hypovolemic shock and death within hours. The cholera toxin stimulates the lining of the small intestine to secrete massive amount of chloride ions and water into the intestinal lumen. This results in the classic watery diarrhea. The body loses fluids and electrolytes at a dangerous rate, leading to dehydration, acidosis, and circulatory collapse. In areas with ongoing outbreaks, doctors may diagnose cholera based on clinical symptoms alone. However, lab confirmation is done through stool culture, dark field microscopy, or rapid diagnostic test. These tests help confirm the presence of Vibrio cholera in stool or rectal swabs. Cholera symptoms can resemble other diarrheal illnesses like rotavirus, E. coli infections, typhoid fever, and dysentery. Rapid volume of stool loss and characteristic dehydration signs help differentiate cholera clinically. If untreated, cholera can lead to severe dehydration, electrolyte imbalancing, kidney failure, metabolic acidosis, and even death due to the circulatory collapse. Children may experience hypoglycemia, and some patients may develop seizures. The cornerstone of treatment is rapid fluid replacement. Oral rehydration salt or ORS can treat most cases effectively. In severe dehydration, intravenous fluids like Ringer's lactate are essential. Antibiotics such as doxycycline or azithromycin may be used to shorten the duration of illness and bacterial shedding. Zinc supplements are especially helpful for children. While antibiotics help in moderate to severe cases, their overuse can lead to antimicrobial resistance. Increasing resistance has been observed in certain regions of the world, making local sensitivity data important in choosing the right antibiotic. Preventing cholera depends largely on clean water, good sanitation, and hygiene. Key measures include boiling or filtering drinking water, washing hands with soap regularly, properly cooking food and avoiding raw seafood, using toilets and managing waste effectively. Public health education campaigns are crucial during outbreaks. Now, let's talk about the vaccination. Three oral cholera vaccines are approved. First one is the Shankol, second one is the Dukoral, and the third one is the Uvicol. These are administered in two doses and offer protection for 2 to 3 years. The World Health Organization recommends their use in endemic areas and for high risk populations during outbreaks. Cholera is a global indicator of inequality. It's preventable with access to safe water and sanitation. Yet it persists in many low income regions. The WHO Global Task Force on Cholera Control aims to eliminate cholera in 20 countries by 2030 through a multi sectoral approach involving surveillance, community engagement, and vaccine distribution. Now, let's talk about some myth and frequently asked questions. The first question is, can cholera be cured? The answer is yes. Cholera can be completely cured. Early rehydration saves lives. The second question is, can cholera spread from person to person? The answer is not directly. It spreads via contaminated water or food. And the third question is cholera still a problem today? The answer is yes, especially during floods, war, or natural disasters in areas with poor infrastructure. Cholera is a deadly but entirely preventable disease. With timely access to rehydration, clean water, proper sanitation, and vaccination, we can protect communities. Recognizing the signs early and acting quickly saves lives. That's it for today. Thank you for watching. I will see you in the next lesson.